Hello everyone, I am Dr. Devyani Thakre. I am a physiotherapist and a certified lymphedema therapist. Today I am having a feedback of one of my very good patients, Mrs. Kamala Prasad. She was suffering from lymphedema of her arm after her breast cancer surgery and she was under my treatment. But the main thing I want you to listen to her is because she has managed and maintained her lymphedema at home, because it is very important to understand about lymphedema and follow all the instructions to get excellent and long-term benefits from lymphedema. So I would insist each one of you to listen to Mrs. Kamala Prasad very carefully about how she has followed her home exercise plan and regime, and consult your lymphedema therapist at the earliest, because lymphedema is manageable.
Hello Devyani, it's been a pleasure coming to your clinic and getting myself treated. I had breast cancer and I had surgery for full mastectomy. That was in April 2016. But only around end 18 I think, the swelling I started noticing. But whenever I discussed it with my doctors, I was told no, there is no, not that we know of any remedy for this, so you have to live with it. But through a friend I came to know about you, Devyani, and I was told please go to her and she may be able to help you. And I immediately came here.
So, knock knock. Lymphedema is manageable. Never say that it is not manageable. Complete decongestive therapy is a therapy that manages lymphedema, and lymphedema therapists are the people who provide this therapy and who are trained in complete decongestive therapy. So yes, lymphedema is manageable.
So it's been about 2 years since I've come here. At the time when I came and today, the difference is my normal hand is very small and very delicate it looks. So this hand had become about 4 times. It had swollen to about 4 times. And from there, Devyani has worked on it so nicely, and I have been following up her instructions very carefully at home. And the result is that now it is about double the normal hand. And what I need to do, and I am doing as per her instructions, is a regular follow-up once in 3 months. And apart from that, if she feels there is a need for any machine or something, she does it. Otherwise, generally she says, no, you're managing it well because you're following my instructions very regularly. And that involves bandaging every day. So we do it every night, bandaging, and I stay in it for about 10 to 12 hours. And after that I give it a gap of 2-3 hours, and after that I'm supposed to wear the sleeve during the day. Now, in the beginning it was more rigorous bandaging only, sometimes even night and day. But the important thing is that not to panic, and to believe in your physiotherapist, and to just follow her instructions and do it religiously. Also, I'm doing something called the MLD, which is the manual lymphatic drainage. She taught me the steps, and I'm simply following those steps very rigorously, very religiously, and therefore today I can state that I am at least in a much better position than originally. It used to look like a big elephantiasis arm.
So, see how important it is to maintain the lymphedema therapy at home, not just in the intensive phase. Bandaging is not enough. Yes, manual lymphatic drainage, the stepwise, is very important.
And another thing that I thought of doing from my side is we have a whole group of cancer survivors, and apart from that, whenever I used to go to my doctor, my cancer treating doctor, I have carried Devyani's cards and told them, sir, please do not in future say that this is not treatable. It is treatable. So please do send your people, your patients to Devyani, and she will be helped, because she's there in Nagpur for our good fortune. There are many cities where there's nobody. So that way we are very fortunate. So I wanted that this message should go to more people.
So that was a feedback I intentionally uploaded on my YouTube channel, just because I wanted to clear off a lot of doubts in which my patients say that it is very difficult to manage lymphedema at home Mrs. Kamla Prasad is one of the patients, ideal patients, who have been following it since 2 years and getting excellent benefits. So yes, it is possible. It just needs a will. Where there is a will, there is a way.